Postgraduate training in surgery has been a point of great pride at Michigan for many years. Our residencies, which include general surgery, vascular surgery, thoracic surgery, and plastic surgery, attract talented people from across the United States and have produced some of the most important surgeons in this country. Clinical training is the bedrock of our residencies and will remain our #1 priority. But many of our trainees are also attracted to the incredible research opportunities of the University of Michigan. And the fact is that winning federal support for resident research endangers this important opportunity. We're excited to initiate the Resident Research Endowment fundraising initiative. It's received incredible support. The Department of Surgery has contributed $6 million as seed funds for this effort. The faculty of the department, who know firsthand the importance of resident research, have pledged $300,000 a year for each of the next 10 years to this effort. The remaining funds to come from alumni, grateful patients, and community leaders. Ultimately, this is about our residents. This is about their futures. These are their stories. Thank you for listening.
The focus of my research has been primarily on the kidney. I've been working with Dr. Wang in ICAM, where he does primarily his research on motor vehicle crashes and individualized tailoring of treatment based on the information we have on the CT scan on each patient that comes in. So my job has been focusing on the kidney and determining what imaging characteristics we can find that may correlate to different things that would affect patient care. For example, we've been able to look at the image qualities of the kidneys and determine which patients are more at risk of kidney failure based on these findings, which is new. And this would provide valuable information to the trauma surgeon because he or she could therefore provide more supportive measures and be prepared for that event if it were to occur. So we know that patients who are involved in motor vehicle crashes that are severe enough where they need a stay in the ICU, for example, have a fairly high rate of kidney failure, anywhere between 15–35% or so. And we know that once you have kidney failure, your rate of mortality is extremely high. It's one of those things that we want to prevent as much as possible because once it happens, all we can provide is supportive care. We can't really reverse the injury on the kidney once it's happened. This research is pretty important to provide new information to the physician that we've unable to see before in the setting of trauma, in the setting of motor vehicle crashes. This experience has been very different from the other experience I've had so far at Michigan in terms of the change of pace in outcomes or change of pace in different events getting done. For example, on the surgical and the clinical side, our pace is extremely fast. We see results within the day. And that's something I had to get used to going back to the lab, that things were not going to happen on that scale. It was going to take months to years to see the fruits of the work that we did. So it takes one thing off our plate in terms of having that source of funding not having to worry about. I can tell you about the many hours that I spent, writing proposals and applying to different places for funding, but that would be too boring. So having this endowment would be immensely beneficial to taking one more thing off of the residents' shoulders, basically, so that they can focus more on what they were planning to do with those 2 years.